Broadcasting now.
Good morning, everybody. Maticia and Katie, are you guys, which one of you all is kicking us off this morning?
Maticia's going to kick us off this morning.
Yeah, I'll get us kicked off.
Great.
I was waiting until 8 o'clock. I don't know if everyone's on. Let me just do a quick look-see. Let's see if we're missing anyone.
Yeah, we still have 1 minute.
All right, so we're now right at 8 o'clock. So good morning, everyone. I would like to call to order the Durham Recovery and Renewal Task Force meeting. Before we jump into our agenda, I do want to highlight that we are trying something a little different today on our agenda. You won't see an agenda topic for our roundtables. In your pre-read materials, we provided a roundtable update, and if there's any questions or concerns about those updates, we can certainly cover those, but we don't have a specific agenda item for that. We've also attempted to create some space in the agenda today, and that's to allow for any open dialogue that task force members may want to have for items that are not listed on our agenda. This also allows us a little flexibility to keep the dialogue going when we're talking about a topic that truly warrants further discussion. So it allows us a little bit of flexibility in the agenda. I do also want to let you know that Katie and I welcome any feedback that any of you may have on the work that's being done by the task force, whether it's the that the task force is responsible for. You know, I wish we had a playbook that we could refer to when things come up, but instead it seems like we're writing the plays as the plays are being ran. So a lot of this for us is new, and we're trying to figure it out, and we're trying to be flexible and make sure that we're adjusting as needed. So please, if you have any feedback, Katie nor I will be offended with any of the feedback that you provide. We want to hear that feedback from you. And my hat goes off to Susan. I hope she doesn't mind me calling her out. But I had a great conversation with Susan on yesterday about just some feedback that she provided to me and to Katie as it relates to some of the things that the task force is doing. And, you know, when you provide us with your feedback, we're happy to listen. We won't be able to probably do everything that you recommend, but we're certainly listen and adjust as best we can. So please reach out and share any feedback that you may have. So with that said, I'm going to turn it over to Mayor Schul and Chair Jacobs to provide any updates that they may want to update us on.
Thank you, Maticia. Wendy, should I go first?
Sure.
Okay, great. Good morning, everybody. Good to see you. This remains just an amazing group, and you all have done so much good work. And again, I want to express my gratitude to you. And I hear that from other members of our community. The fact that you all are getting together to do this builds a lot of confidence in our community that we have great people around the table and making the best decisions that we all collectively can. So thank you so much. I do want to mention just quickly two things today. One is that This afternoon, Wendy will sound the county order, and then I will incorporate that into the city for an amendment, the 8th Amendment to our Safer at Home order, which does two things this time. One is it allows open houses under safe conditions for real estate. And the second, which the real estate industry has been wanting. And the second thing it does is it allows for gyms and other physical fitness businesses to operate outside with up to 25 people under safe conditions, which is one of the things that the gyms and fitness industry has been wanting. And thanks to Rod, as always, for reviewing these before we issue them. And the second thing I want to mention is just what's on my mind this week as a priority, and it really continues very related to last week, which is our ability to do all the testing and tracing that we need for, especially for our Latinx community, but for our vulnerable populations, the ability to, in the next couple of weeks, to really figure out what that number is and to move to get to that number, not only of the test that we need, but the contact tracing that necessarily comes along with it. And I know this is going to mean new resources, and we have to figure out how to get them. We know that our public health folks are stretched really thin. I heard Rod say the other day they'd been contact tracing every day for 95 days. We need to make sure that they have the support that they need, that Lincoln has the support that it needs, and that if we need more testing sites, that we're able to get them, more tests and more tracers. So that's what's on my mind that I hope we'll spend a lot of effort on this next couple of weeks. And I know a lot of you all are concerned about that too and trying to help figure it out. So thank you very much. And I'll turn it over to Wendy.
Well, good morning, everyone. And it's always great to see everyone's faces and to be a part of this amazing effort. And I just want to echo the mayor's comments that I'm so grateful to each and every one of you for what you're doing and your valued input and all the work that you are doing in the community and as a part of this process. I would just say that I think that the order this week is really an expression of the success of this task force, because both of the aspects of this order actually came out of the work of the roundtables, directly out of the roundtables related to the real estate industry and trying to meet the needs of the real estate industry and also the fitness centers. So I think that speaks to what we want to see happen, that we hear things that come up, the recommendations from the roundtables, from the business sectors to help guide what we're doing. As Maticia said, we don't have a playbook for any of this, and we're all trying to make the best decisions possible. I want to also add, in terms of what is, what I'm thinking about, and I'm sure a lot of other people are too, is just, again, our rising numbers and in the Latinx community. And I know Rod will talk more about this, later on. But again, I heard from Rod on Wednesday at our MAC call that our confirmed cases were now 73% members of the Latinx community, which of course is very alarming when this sector of our community is only 14%. And also the latest epidemiological information modeling from Duke, unfortunately this week shows us at a 3.8% growth rate, and the state's 3.4%. So now we were level with the state. Now we're back exceeding the state's rate of growth. And also, we know we've been on the radar of the White House and DHHS as one of the counties that is standing out for our numbers. We know, so in a way that it's good because it means that hopefully we'll get more resources that we need. I think that we do need to recognize that Rod is not Superman, and all of our public health staff, they need support, and we need some extra support and resources and help. And so I'm going to look forward to hearing more about that in our meeting today. And I also just want to say, from what I'm hearing from the work that all of you are doing and from the roundtables, is I just see also a deepening of that and getting more into the complexity of what we're doing, and that we know it's also contact tracing and testing, but then it gets beyond to a lot of the things that Pilar spoke so much about last week, about we need a comprehensive approach related to wages and food support and, housing, safe recovery, away from your family, possibly, things like that, that I think we're going to need to really come together as a community, and that that our task force and the roundtables really, we're going to have to kind of sound the rallying cry and bring our community together to support our Latinx community. So I look forward to our discussion today.
All righty. Thank you, Chair Jacobs and Mayor Schul, for those updates. And just based on your comments, we still have a lot of work to do as a task force. But we've also gotten a lot done since we first started meeting. I think it was maybe the second week in May. I think this is maybe our 5th meeting. And Katie's gonna run through just some of the things that we've actually done as a reminder of all the great work that's happened over the past month or so.
Thanks, Maticia. So you have this brief in your briefing materials, and we thought we'd sort of create a rolling item list, but when we put it down on paper, this team has done tremendous work. This is a really heavy lift, and as others have said, we're making the plays up as we go along, right? Because this is unprecedented, but tremendous work here. So data, under data, we've been educated as a task force on Durham's data hub, Durham's COVID data. We've worked with Rod to identify, and Dr. Akinboyo to identify the 3 key metrics to follow that will help our community better understand the data: the number of cases, the 7-day average of new cases, and the positive rate for testing, which we're still working with the state. And I heard Rod on a couple of meetings this week push on that. He has been a very strong advocate for us getting that information from the state, and many others of us have been advocating for that as well. So face coverings, we have 2 work streams, and Ed has done tremendous work here, but 2 work streams, one focused on getting face coverings to the underserved communities, and then another focused on identifying PPE for businesses, and a lot of work being done there. Vulnerable communities, we've established an action team on vulnerable communities, as well as a roundtable on immigrant and refugee issues and the unique needs of those communities. And Pilar did a great job last week of highlighting all of the work that is being done, and that's in your briefing as well. The communication and voluntary communication, or voluntary cooperation Center for Advanced Hindsight, has been working closely with McKinney, who has been doing some pro bono work, and we have that later in the task force meeting this morning. Really excited to be able to share that work with you, because I think they've done a phenomenal job with that. The roundtables, we've established 20 industry-specific roundtables to advise on best practices, self-certification. These roundtables are really advising on what's specific to their industries and advising the mayor and Commissioner Jacobs on that. The faith communities, Reverend Davis has done a phenomenal job there as well, bringing together many different faith traditions to discuss how to safely be able to reopen and get back to worship in a safe way when those faith communities are ready to do so and comfortable doing so. And then community engagement, we'll hear more about that today. So when we think back on just the first really month of our work, again, this is a heavy lift, but a lot has been done. So we just wanted to take a moment to pause and reflect on that and really thank all of you. Thank you for everything that you're doing and everything you're contributing and giving back to the community.
That made me tired with you just going down that list, Katie. That's a lot of great work. And again, many thanks to everyone that's contributed, because as I look at your faces on the task force, I think all of you probably have jobs, you have families, you have volunteer events that you engage in. So this is added work to the work that you are already doing. So thank you so much for making the time to do this great work. And as I mentioned, we still have a lot of great work to do over the next couple of months. I'm gonna just give you an update on the roundtables. So in your briefing materials, there was a roundtable update. I'm happy to take any questions about the updates that were provided in that summary. I do want to let you know that we are working to create a standard template that we can use to report out on the roundtables, so that we have some uniformity around what's happening at the roundtables, and so that what's being reported to the task force are those significant items that we need to be made aware of. I did get an opportunity to participate in a few more roundtables this past week. I wanted to participate in them all, but I couldn't. And I will say, in the places of worship roundtable, there was some conversation around, we've met our overall objective. What do we do next? And it was, to me, amazing how that conversation kind of pivoted to, okay, we've met our objective, but there's still work to be done in the community. And how do we worship leaders help our Latinx community? So Dr. Davis, I felt like a proud parent as I sat there listening to that conversation, because it was just very encouraging to hear our leaders that had come together and recognize that, it feels like we've met our objective. Do we stop meeting? Do we continue to meet? And they pivoted to what else can we do to help? So that was great. And so I was taking notes from my playbook as I heard that to share with other roundtables. So I'm just going to pause. You've seen the roundtable updates, a lot of great work that's happened with the roundtables this past week. Are there any questions based on what you saw in the summary that was provided? Okay, hearing no questions, then I'm going to move to the next topic, which is phase 3 planning. I know all of you have probably figured out exactly what's going to happen in phase 3, and you're ready to have a robust conversation around that. But we do know that there will be another phase coming relatively soon. And what we want to do as a task force is start thinking about that, because as you think about our overall role, our role is to advise Chair Jacobs, Mayor Schul on how do we recover and renew safely. And so we want you to start thinking about what could possibly be in phase 3, because we don't know. We don't know. We don't have all the answers, but we want to have some dialogue at our next meeting about your thoughts around what could possibly be in phase 3, and how do we position ourselves as a community in Durham to safely move things forward. So I'll ask that you just do a little bit of research, because you think about the reopening plan for the state. We had phase 1, 2, and 3. Things have not gone exactly as planned. Again, we don't know with 100% certainty what's going to happen with this next phase, if it will be called phase 3 or something else. But we want to have some conversations about what could possibly be in the next phase to prepare us to provide feedback to Chair Jacobs and Mayor Schul in a timely fashion, so that things don't start to expand in opening and we find ourselves somewhat flat-footed. So just give that some thought, and the plan is on our agenda for our next Friday meeting. We'll have a more robust conversation around that. Katie, you want to talk a little bit about the face covering?
Yep, I will discuss face coverings. So you should have in your, again, in your briefing, recommendation on face coverings for vulnerable populations. I hope everyone's had a chance to review that. I know the materials, there were a lot of materials last night. So just in case, I will quickly highlight some of the recommendations. First of all, the recommendation is that the county and Cover Durham coordinate distribution of face coverings to ensure we can cover a wider area by avoiding unintentional duplication or not distributing to key locations due to assumptions that someone else has it covered. And again, just as a reminder, what we're talking about here is we have more than 110,000 face coverings from FEMA to be distributed to nonprofits, and then an additional 44,500 from Cover Durham to distribute for free, and plans to secure an additional 50 to 60,000. So we have actually a very good supply of reusable face coverings that can be distributed. Also recommending determining whether different masks offered by the county and Cover Durham are better suited for some more than others. And this is because there are cloth masks, and then there are multi-use but not completely reusable masks. And so understanding which go where is going to be important. Recommending that the county and Cover Durham consider some of the following strategies in distributing face coverings: providing face coverings to trusted, community-rooted nonprofits who can distribute to their frontline service providers, and to frontline service providers of other nonprofits, and to residents they serve. So examples: Lincoln, El Centro, Project Access, the nonprofits that support and work with the Durham Housing Authority, those that already have some type of distribution network already built into their model, so that they're not starting from the ground up on this. Providing face coverings at public locations that see regular traffic and where many lower income residents may visit, transit riders through bus drivers, social work, Reinvestment Partners Vita site at Northgate Mall, the courthouse, and DPS, Durham Public Schools summer meal sites. And then provide face coverings to trusted messengers who interact regularly out in the community, especially in communities of color and with vulnerable populations. Examples include, but not limited to, Bull City United's Violence Interrupters and Welcome Home's peer support specialists. So, and then there is a description of the distribution process that was in there. Are there any questions, concerns, things that you think were left out of that recommendation that need to be considered?
Katie, this is Wendy. That was a great report. Thank you. I did read that last night. Thank you to everyone who worked on that. I really appreciated the thoroughness of all of the thinking about face coverings and all the questions that were really asked. So a few of my questions are: how will this recommendation get directly to the county and to Cover Durham from the task force?
That is an excellent question. How would you like to receive it? And we have the recommendation in writing for you that.
Yeah, I think I would suggest, it could be sent directly to, even just the mayor and I, and then we can make sure that it gets distributed to staff and to the, Cover Durham. I think that might be the simplest way.
Okay.
To do that. I don't know, or maybe Jody, you may have a different suggestion about that. Because we obviously need to get it to the EOC and the Cover Durham folks and the Community Health Coalition. So I don't know. What do you think, Jody?
Chair Jacobs, I believe that would be the appropriate way to share the information through you and the mayor. I was also sitting here and thinking about, I'm wondering if we don't need to broaden the recommendation somewhat and include the city and DPS as part of working in collaboration with each other to help distribute these masks. And there were a lot of areas where Katie had mentioned where they're touching those communities and those organizations already. And I think working in that more collaborative, broader sense may help us distribute the inventory that we have now in a more timely way, and also to make sure that we're really providing the masks to those most in need, but also we know that the masks provided by FEMA specifically have to go to nonprofit agencies and organizations, and making sure we're following appropriate guidelines. And so I would suggest to the group that maybe we look at the recommendation and consider including the city and Durham Public Schools as well as part of that cohort that really works on a strategy for distribution of the masks.
Excellent. Thank you. We can add.
Great.
I have,
And I just want, oh, sorry, one other quick thing is I just want to hear a little bit more about the education piece, because Pilar's shaking her head. I think we need to make sure that we're including basic public health information, and also how to wear and take care of the masks. And also just thinking about masks for children as we think ahead for Durham Public Schools and just our broader community. So those are my two other questions. And then Pilar, go ahead.
no, thank you. That's what I was going to say, that it is really important to include the information and the education piece, because if not, I don't think we will do much just giving the masks, but not pushing people to understand why to use it, because that's what we want, yes, for people to use them. And also if there are the cloth masks, how to maintain them clean and, do all the process, because I think that's very important. So that's what I want.
No, that's an excellent point. And I thought we had that in here, but now that I'm looking at it again, I know we discussed it, but may not have actually put it in here. So we'll add that important piece in, because we do need to add the education component of it. Absolutely. And then I agree completely on, I think we need to do some work. And I was hoping that Cover Durham could help us with children's masks, because there will be dollars there that have not yet been spent to purchase masks that we could provide children's face coverings. I would look to Dr. Akinboyo can maybe help us with that, since she has such expertise in pediatrics in particular.
Yeah, happy to help. Just let me know.
Okay, thanks. Any other questions on this?
I have one more point just for us to think about, and I guess we'll get into this with the presentation from McKinney and Center for Advanced Hindsight. I think related to just the face coverings issue is just how we also keep people wanting to wear the face coverings. I was out and about yesterday, and I definitely saw less people wearing face coverings than I would have, I think, a few weeks ago. So I think, again, I think it's just part of our overall sustaining the best practices that Rod and public health are trying so hard to keep reminding us about, that how we keep sustaining that, because we know it's hard to wear face coverings, and it's hard for people who are working all day to wear them. And as it gets hot, it's really becomes uncomfortable. So I just think that's another thing for us to keep in mind.
Absolutely. Thank you. Okay, the other thing I wanted to update on was the student research support, and that again is in your briefing materials. I'm not going to go through it, but I do want to take a moment to just thank the grad students that we have working with us, who are doing just tremendous work researching different topics each week, and providing background materials for us in those briefing materials, and lots of links in there if you had a chance to really look at the briefing materials. So as you are working with different action teams or roundtables or in your own area of business or organization, please reference those, because they've done a lot of great work to pull together best practices and what they're seeing nationally in terms of different ways that people are approaching. So I'm not going, unless there are any questions, I won't
I'd like
spend
to
too
just
much
add one thing, Katie, if I may. I'd just like to encourage, if task force members have any research questions they would like this student group to assist with, please email them to me. You can email them at any point and I can assign them to students. So we have 11 and that number will probably grow. So we have a lot of research capacity. So if there are any questions you have that you would like to learn about what other communities are doing or other best practices, just email me your questions and we'll get a student working on it. Thank you.
Thanks, Ryan.
And these students are from Duke. They're graduate students. I'm sorry, it might have been in the briefing material.
So we currently have students from Duke. We have a student from UNC, and I've been working with Anthony Nelson on students from NC Central. So the goal is we'll have students from, predominantly, ultimately from Duke and NC Central, but we're still working on that recruiting process. So this just started getting going last week.
And they're just there to do any kind of research we would like for them around COVID-19 concerns and
That's
recovery.
correct. They're I think of them as like a research team for the task force. Primarily what I have them working on now is we're in a unique situation where we can learn from cities across the world who are struggling with similar questions we are. So what might we learn in terms of how other cities are approaching some of the same challenges we're facing? What things might we learn in terms of unintended consequences of well-intentioned policies? So there's a lot of things that we might learn, but there's so much information out there. It's very difficult for all of us to stay on top of it all. So having, an extra 100 hours of research eyes out there looking every week. The other thing I'll note is all of these students are volunteering. As you all know, the task force has a budget of approximately about $0. So just appreciative of everyone, including many of you who are just volunteering in this moment where we all have to rise up to assist Durham. So I hope that answers your question, Nicole.
No, it did. I had heard reference to it, but I missed that we were bringing them on. So I think it's great. I would agree.
Great. Thank you. The other thing, just while we're under chairs updates, just one note, programming note, if you will, the week of the June 29th, which ends on our task force meeting would be on July 3rd. That is a holiday, so we will not be meeting that week. So everyone will have the gift of time that week. And with that, I will turn it over to Rod to update us from public health.
Good morning. Can you hear me?
Yes.
Okay. Good morning to the task force and to the members of the Durham community. Much has been said so far, and I will like to start off by saying, and just really as a point of clarification, Katie and I have been in a number of different calls with the state, and I'm glad she's a trusted partner and can back me up on some of the things I've said. The White House watch list, I just want to make sure I address that. It's important for the task force and Durhamites to know that we were not, as Durham County, listed on that task force briefing. I gave a little pushback because I searched the document about 3 times and I looked for Durham County on that document and we were not on there. And we were not listed as a top 50 county or anything like that. However, we were listed on the CDC's list of counties with rising cases that they were concerned about. So I just want to let you all know that we were not on there. And in a meeting that I had with the secretary of Health and Human Services, Mandy Cohen, along with the county manager, Wendell Davis. I made it a point to ask for clarification on that, and she confirmed that Durham was not on there. However, Durham is in the triangle, and the triangle is connected, of course, and they wanted us to ensure that we had access to those resources that Chairman Jacobs ever so carefully recommended. So we want to make sure that we put that out into the atmosphere. We are concerned, of course, we continue to be concerned about our Latinx community. As Chair Jacobs did say, it is a fact based on data that they represent 73% of our cases as of last week. Of course, you all know that we employ a strategy in our metrics of looking at our 7-day rolling average. So without further ado, again, our within the United States, we were looking at 1,994,283, quickly approaching 2 million cases of COVID, if we're not there already, with 112,967 deaths. State of North Carolina, we're quickly approaching 40,000, if we're not there already. 39,481 cases of COVID, resulting in 1,064 deaths. And in Durham, as of yesterday, we were at 2,473 cases of COVID, resulting in 57 deaths. Of the 57, ladies and gentlemen, only 10 were not associated with long-term care facility outbreaks. I do apologize. We're getting a lot of feedback. If you don't mind, please muting yourselves if you're not speaking. I will try to continue. We continue to encourage everyone to utilize the data hub, if at all possible. That's our source of accurate information. Katie can attest, we did provide the state with an upfront glance of our data, and they did indicate that it was much more rich, much more robust, and much more accurate in our Durham County's information than the state's information. So as a point of personal privilege, I'd like to shout out my Deputy Director, Tara Blackley, and EMS employee, John Paul Zita, because the Data Hub was their brainchild, and they created and they continue to cultivate it. And I'm very proud of it because the information there is accurate and it's very, very robust. So we're thankful for them. As far as trends are concerned, we did indicate that as of June 8th, which was Monday, we were sitting at 2,247 cases, which represented a 570 case increase from last week. Our 7-day rolling average continues to move forward and increase, with 82 being the average for last week, which was up from 58 2 weeks ago and 41 3 weeks ago. So our cases do continue to increase. There were 632 new cases so far in the month of June, which clearly indicates that not only North Carolina's trajectory of lab confirmed cases are increasing, but Durham's trajectory of lab confirmed cases are increasing as well. We continue to promote health equity, which is central to Durham County government's values, but particularly very essential to Durham County Health Department's values. And we continue to highlight the ills of structural racism. And Chair Jacobs, I hope you don't mind us plugging Monday's Board of County Commissioner meeting, which really emphasized the county's strong stance on racism being a public health crisis. And the county commissioners have pledged to really put some action and not just words in doing things to really end structural racism and to really promote health equity for all. So we are very, very elated that we have a county commission that are really, really committed to making these things happen. So we're thankful for that. In June, as indicated, most of our cases are with the Latinx community, representing 73%, and they do represent 14% of Durham County's population. The Black or African American are underrepresented at this present time for the month of June. They only represent 11% of our cases, but 37% of our total residents in Durham. And whites represent 12% of our cases. However, they represent 54% of Durham County's population. As new testing sites open, we will continue to collect demographic data, more on race, ethnicity, and work. So we want to make sure we point that out as well. And again, so far in June, we're continuing to see construction and people living and working in nursing care facilities, and also people who are unemployed as our greatest source of employment data as far as COVID-19. 89% of cases associated with construction work settings were Hispanic or Latinx, and 89% were male. 55% of our cases were associated with nursing care facility settings. They were Black or African American, and 58% were female. And 78% of our cases that were associated with unemployment settings were also Hispanic or Latinx, and 83% were female. Under surveillance, as Katie has alluded to, we are not letting up on the state in our quest to receive both positive and negative lab results. We continue to petition Secretary Mandy Cohen for this information. And it has been said to the members of the task force that Governor Cooper is contemplating an executive order which will require all labs to report both positive and negative results. Again, that's just pure speculation. It's what I'm hearing from the North Carolina Department of Health and Human Services. So I wanted to pass that on to the group as well. With the information that we have, again, we get a lot of information from Walgreens. We get a ton of information from Duke. And we break it down into insured population and community base. Particularly with the insured population, our positive test prevalence in this population is 15%, which is up from 13% last week. And our community-based positive test prevalence continues to hold steady at 17%, which it was last week. I am pleased to announce that CVS has added 2 additional sites in Durham County for a total of 6. And again, this is CVS sites where our residents can go to get tested. The first site is on 3737 Roxborough Road in North Carolina, in Durham, North Carolina. And the second site is going to be 1845 Martin Luther King Parkway, which is also in Durham. I want to also add, the chair did ask a question in reference to CVS. Madam Chair, I do apologize for not getting back to you sooner, but I knew that I'd have this opportunity. CVS, I did reach out to Courtney Herring, who is the Regional Director for Governmental Affairs for CVS. And she did indicate, and I quote, "There is no charge for any individual seeking testing at a CVS testing location. We do not collect payment on site. For those with insurance, we are able to build their plan. However, there are no copays. All uninsured individuals are being covered under the federal HRSA program." So I wanted to make sure I got that information to you. With them having 6 sites in Durham, it's important for our residents to know that they can go there. So again, we continue to have robust opportunities for our residents to get tested. But again, the communication factor is important. If I may, my co-chairs, I know the agenda does ask for me to speak on contact tracing. Is that okay?
Absolutely.
Yes,
Okay.
please.
Just a few words. And again, very, very grateful to the great work that in partnership I have with Dr. Ibukun Akinboyo. She did provide me with some great points to discuss in terms of contact tracing. But I just want the community and the task force to know that we currently have a team of 30 for contact tracing. We have requested an additional 25 contact tracers and an additional 15 contact investigators through CCNC. As I mentioned to Chair Jacobs in the MAC call, and I'm saying to the task force members, the state has been a little slow when it comes to getting the platform off the ground. And Durham County was the first county, non-piloted, to go live with their CCNC CCTO platform for contact tracing. We are entering week 2 of this platform, and it continues to go well. There are significant hiccups, and I do believe in being very transparent. The majority of our cases are Spanish, and Latinx or Hispanic, and it really requires individuals to, and Pilar can chime in, it's one thing to be bilingual, and it's one thing to be able to partake in conversational Spanish. And what we're finding is that individuals are saying that, yes, I'm bilingual and I can speak Spanish, but they are unable to partake in conversational Spanish. And Mr. Mayor and Chair Jacobs, this is what we desperately need. We need individuals who can convey the information in a manner, conversational manner, that really gets to our community and helps them to understand. So we're working our way through that. We also found that CCNC did not have a tool or a method for language line interpretation. So we are lending our language line apparatus to our contact tracing team through CCNC, and we are working our way through that because we desperately want them to be able to convey our public health message and information, which is critical to survival, to our residents. So we are in the process of doing that as well. We are continuing to work with our great partner, Duke University Medical Center, Katie's team, and an organization called Cure Americas for translation support. We're also grateful to Duke School of Nursing, who is really ramping up to assist us in our contact tracing efforts. And it's really based upon the success that we had, ladies and gentlemen, with Duke's PA students. We missed them, and it is my understanding that if available, they will come back and try to help us as well. So again, we are doing our best to multiply our force in order to help our Hispanic Latinx population. Some more information about contact tracing, and I'll be able to open it up for questions. Contact tracing is so important because if you kind of tune your minds to a spider web, there are all kinds of links. And with contact tracing, if one of those links in the spider web is missing, then it makes the whole web fall apart. And that's what contact tracing is that's why it's so important. Before it starts, the suspected case is contacted in order to confirm the details. All information is kept confidential. And to our residents who are Hispanic, we just want you to really know that we are really very, very steadfast in making sure that your information is kept confidential, and we want to build your trust. So when public health calls, it's critical that we get this information from you because we want to really help. The goal is always to stop transmission, and understanding the details of the case is vital. So again, tracing helps our public health workforce to figure out when the symptoms started, when the transmission might have occurred, to determine who meets that criteria for close contact. As indicated, this week has been a flurry of activity with the North Carolina Department of Health and Human Services. At one point in time, we wanted individuals to be tested. We wanted individuals to be tested if they were symptomatic. Based upon the activities recently with a lot of our Durhamites and a lot of our Americans who thought it not robbery to let their voice be heard, they participated in protests. And the new guidance is really encouraging, not mandating, but encouraging those people who participated in protests to get tested. So as your health director, I'm asking you, I'm pleading with you, if you did participate, please consider getting tested. Additionally, if you're determined to be a close contact, whether you're symptomatic or asymptomatic, the new guidance is asking you to get tested as well. Again, during the process of contact tracing, an infected person is provided with lots of information and resources to ensure their household contacts remain safe. One thing that I've learned in my short time with Durham is that Durham is all about helping our community, be it housing, be it food, if there's food insecurities, we are doing everything we can, and that extends itself to contact tracing as well. If during an investigation we find that you have needs, public health will work tirelessly to ensure that you have what you need in order to stay in place, in order to quarantine safely, in order to not go hungry, in order to make sure that you and your family are squared away. We have done a number of different things throughout my tenure here, providing food cards, providing hotel and sheltering for those people who need to separate themselves from the families. That is just what Durham does, and that's definitely what Durham County Department of Public Health does as well. Again, once a close contact list is generated, then our tracing team reaches out to inform those contacts about potential exposure. And again, it's not a perfect science. And to Chair Jacobs and Mayor Schul, I will say, we do our very best, but our information and our efforts are only as good as the information that we receive. So we do our best to create a very comfortable, confidential conversation through our contact tracing team in order to get that information. Some of it may be missed, and if it is, we do extend an apology. But again, I can assure you that, as I've said many times before, we have never veered away from doing full contact tracing. We have scoured medical records to get data and get as much information as we can to contact everyone we can to reduce transmission in Durham County. Again, contacts are provided with education, information, and support to understand their risk, what they're supposed to do to separate themselves from those who are not exposed, to monitor themselves for illness, and the possibility that they could spread infection to others. These are all information that we provide to them at every contact. And then again, contacts can be tested if they are high risk, already showing symptoms as part of a group, and have been severely affected by COVID-19. Make no mistake about it, ladies and gentlemen, these steps take a lot of staff. It takes a lot of resources to track every case, to record the details and to follow up with contacts, and to provide ongoing monitoring and notification. I thank the chair of the County Board of Commissioners and the mayor for being concerned about contact tracing. You've been concerned for quite some time. We have done everything that we can, and we continue to do everything we can to contact trace effectively. We welcome resources and opportunities. I know the mayor has expressed some angst and has some great ideas about the possibility of expanding our contact tracing workforce. And I'm here to tell you that we welcome it, but it's not a matter of us not being able to do it. It's a matter of us having the methods and the capabilities to clearly convey our message to our Hispanic population. We continue to work with Pilar, El Futuro, El Centro, Isla North Carolina, Latin 19, and as many healthcare officials and professionals of the Hispanic origins to do the very best we can. Thank you so much, and I'm opening it up for questions right now.
Thank you, Rod. And I know all the work you're doing, and I'm happy to hear there are more sites for testing with CVS. But I still have the concern because we still have community members, and not only from the Latinx community. I've been in other meetings with Black communities, and they are still lacking of how to really get to the test because the information, I always point the website, I send them the link. It's not as easy for them, for our community members to navigate. You have to give them exactly what it is. So I think we still need to think about bringing testing to, and probably I was looking at the report and the map, and we know some of the areas in Durham that probably we should bring the testing, and not only the testing, but also the educational piece, and also to hear, we are talking about isolation for families. Is really difficult to isolate sometimes. So if one person gets sick, the rest are sick because there's no way to isolate. So I still think we need to think about doing some mobile testing, and probably Duke can support this, and We can go to churches that people trust or community centers. I don't know, I think we really need to be more aggressive on that. And I'm willing to help in any way we could do. And also with the tracing, I agree with you. People need to be not only to be able to speak Spanish, but also to be bicultural, to understand our community. And even the way we ask the questions. People, with our community is more complex because all the fear to share information and everything. So in that regard, I've been pushing friends and even our health promoters probably to apply to some of the jobs they are putting out there for tracers. There are some barriers for the people we know could do it, like transportation. They need to have a driver's license. Some of them can work only by telephone. So we've been trying also to push that, and I've been thinking how we as an organization with our health promoters or us could help with this. We are so stretched out too. All of us, we are all day long working on the phone, helping people with food, rent, and utilities, and testing and all of that. But I'll be happy to talk to you and to see how else can we push both testing and tracing.
Hey, Laura, to that, I say thank you for all of your efforts. And I will say to you, get ready because we're coming. We had a very robust and very insightful vulnerable populations work group meeting, which I think you will hear about a little bit later. And to my co-chairs, I don't mean to be as long-winded, but this is good information. And I just want to make sure that I cover all my bases. The vulnerable populations work group meeting was a good one. And we came up with a strategy as a team, as I said to Katie Galbraith last night. It's a team strategy. And I feel as if our tactics will work. And that was conveyed to the state on yesterday. And we're not necessarily fans of just mass testing for the purposes of mass testing. We're fans of the purpose of the strategy of mass targeted testing. And we do know that we have a gap in East Durham. And although there are more sites coming, it could use a steady stationary site. So we're working on details for that. And we also would like to use El Centro as a site that is a place of caring, a place where our Hispanic communities are used to receiving good information. So that is a part of our strategy as well. We've unequivocally let the state know that we would like resources. And these are the things that we need in order to help our Latinx population. And to our Black population, African-American population, we hear you loud and clear. And we do, I will be on a conference call with the state on tomorrow at 11 a.m. in an effort to deploy a strategy for our Black community as well. And I'm proud to say to Dr. Davis, forgive me, I called you Herbert Richardson yesterday. I apologize. I know a Judge Herbert Richardson in Robinson County, but Dr. Davis, it's going to involve the faith-based community. And I'm super excited because I know it's going to work and it's going to be great. And we're going to do what Durhamites and Durham County always does. We're going to come together, and within the next few weeks, we're going to employ a strategy to help Durham rebound and get back to where it was just a few months ago. So more to come. Again, there's no shortage of work, and it certainly takes this entire task force and this entire community to make a difference. We thank you so much for all your efforts.
Excuse me, Rod. Thank you. I'm glad that you'll be able to work with the places of worship. I have a question regarding the data hub. And I was wondering from a meeting I was in this week, is the information about testing at the Durham Detention Center, is that included in the data hub? And if not, would it be able to be included, especially with the major issue across the state regarding testing of inmates?
I will say, as it stands right now, no, it's not. more than happy to have some conversations with Sheriff Burkhead in reference to it. And I'd be more than happy to get back with you, Dr. Davis.
Thank you very much.
Yes, sir.
I have a quick question, and not something that I think we should address today, but that at some point I think we should talk about. Everything is indicating that North Carolina, and then from what Rod shared, and thank you, Rod, I really appreciate these briefings at the beginning of our task force meetings. Cases are going up. And I know we're all about recovery and renewal and opening up the economy, but aren't we also responsible for knowing what those triggers might be that would require us to back up a little bit and perhaps slow things down because the cases are getting out of hand? And I don't think it would be responsible of this group to not address that and to not talk about what those things look like so that we can give adequate time for businesses to prepare. All of them now are very much in this let's get open, 50% capacity, outside workouts, whatever, in order to start making money. And I am not saying that we should stop that, but if the evidence is showing that we need to slow things down, we need to give those businesses and people enough time to be able to adjust to that and what that looks like. So not something to discuss now, but I'd be very interested in hearing maybe at the next meeting what we can do on that, because it just looks like it's ramping up. I heard Dr. Cohen on NPR yesterday talking about it. Rod just shared it's happening here in Durham. And I, maybe this is just a fluke and it'll start going down next week, but just to be prepared.
I think that's a really good point.
I'm sorry, yeah, but that's a great point. And the one thing I can say is I'm extremely proud of the mayor and Chair Jacobs, because even at the onset of them crafting their safer at home order, stay at home order, if you will, they took a very hard stance. They took a tough stance, a very unpopular stance. And it kept, from a public health perspective, it kept a lot of Durham County safe and free from COVID. We went from student travelers being the most infected group to long-term care facility, nursing home individuals being the largest. And now we're here for our Hispanic community. And through all of these large groups, we've been able to employ strategies in order to mitigate and to assist. And I feel as if this current time that we're in, Nicole, is not going to be any different. But you're right. I think it was encouraging to see Orange County take the position on masks. I think they're copycats, if you will, because Durham had taken that position and stayed really steadfast with it, and it kept us safe, and it continues to keep us safe. So yes, you're right. I mean, these are the times, and this is the purpose of the task force. And I thank the co-chairs for having the idea for us to come back next week about us really speaking on what we really think would be best as far as phase 3. Is it like, hey, let's just go ahead and just pump the brakes and really pay more attention to the numbers? Or is it, the fluke that you just mentioned, and I hope it is. But, we'll continue to follow the data. We'll continue to publish the data, and we'll continue to articulate the data for our community.
I think that's important that we're leading with the data, and then we are able to hear what's going on, and it better informs all of us to kind of think collectively about what it looks like. So again, I appreciate the link to the data hub. We're pushing that out, but then just you taking the time to go through the detailed report. And yeah, I'm fine with you taking as much time as you need to make sure we get all of the different points that we need to. That's your world, and breaking it down so that someone like me can understand, I appreciate it. So thank you.
Can I just want to jump in here though, Rod. I think you're always great at articulating all of the issues, and I really appreciate you. I'm just very grateful for you and all of your staff. I think one important thing that you always do is put the data in perspective. And I I want to bring up a point that you said on the MAP call, and that you've raised before, and that is looking at the community spread rate. And if you could just talk about that for a little bit, because I think one positive thing related to what Nicole is raising is that our community spread rate has stayed about the same. Is that right?
That's a great point, Madam Chair. You're correct. Community spread, again, really details, and Eva can, before I get too dangerous, you can jump in as well. But it does detail like the true rate of infection. And our cases can be transmitted or translated in a number of different ways. But what we're seeing now is what we call close contact. And that's the rate of COVID transmission that's really spread by people who are very close to one another. By close contact, the CDC defines that as 6 feet or less for more than 15 minutes. And close contact is where our numbers are creeping up, whereas community spread remains at 17% for our community, which is great, which means that people are wearing their masks, people are, when they're out and about, they're maintaining their distance, they're employing the 3 W's, they're washing their hands, they're wearing their masks, and they're waiting 6 feet apart. So again, we continue to spread that message. But make no mistake about it, community spread, as evidenced with the 80-something% of our Latinx, really translates to be their spouses, their households, their wives, their kids. That's where a lot of the spread is coming, because they have COVID and they go home, and they're such lovers of togetherness, as we all are. It's tough for us to not be amongst our loved ones and to be able to hug on them and to be able to be, to have our babies on our laps. And it's tough. It's a tough space to be in when you have COVID and you have to isolate and be away. That's like ripping somebody's, as a father of 2 kids, it would rip my heart out if I could not have my babies next to me. It'd rip my heart out if I couldn't have my wife next to me. But best believe, if I have COVID, she don't want to be anywhere near me. And that's just the honest to God truth. So again, community spread continues to be low, and that's through efforts of all of us as on this task force. And we're continuing to work with the messaging with Pilar and Isla and all the other Hispanic advocates to clearly communicate to them about the dangers of close contact, but more importantly, to let them know, like, when we do call, please be truthful, honest, and direct with us about who your close contacts are so we can contact them as well.
So, and just to follow up, I think, Nicole, to your point, I think that's a really important point, because what it means is with the reopening that we're doing, that the businesses that are reopening, if they implement the best practices, that there are safe ways for us to reopen and not create community spread. And so I think that that's just important for us to focus on that as well.
So Rod, I have a question. So this has been great conversation. So thank you so much for leading this conversation. As we talk about contact tracers, and I think about what you said, I think you said you have a team of about 30. You have 25 contact tracers that you requested or just got from CCNC. You have maybe about 15 investigators, I hope I got that number right, that you've also requested. As you think about where we are today, what is your capacity like for today to do what you need to do? And I asked that question understanding that we do have some challenges with the ability for your current team to engage with the Latinx community. But in terms of your capacity as of today, how do you feel about that capacity?
That's a very great question, Maticia. Thank you for asking it. And it's a question that I ask almost on a every other day basis. I'm constantly going to my team and asking them about what you need, because as a leader, it's our duty to make sure that they're equipped to do their job and they have the resources. And the question was asked to my team right before this meeting, because I had a feeling that contact tracing was going to be a part of the agenda. And the answer was more or less like, yes, Mr. Jenkins, we have sufficient staff to adequately contact trace at the present. Yolanda Massey is our regional supervisor for our CCNC apparatus. And I'm constantly texting her, talking to her all day long. And she's an advocate. She's pro public health, and she understands the needs. She's concerned because, again, our relationship is extending to about 2 weeks, and we are sending our contacts to them constantly. And to hear that they didn't have the foreign language translation capabilities was disappointing at best, but our work goes on, so we find a way to get it to them. So to answer your question, Maticia, yes, I feel as if expanding our bandwidth will continue to help. As individuals are discharged or recover, it's going to be helpful, but at the same time, let's make no mistake about it, the state has mandated that we ramp up testing. So as a result, more testing, more tracing will be required. So the expectation of the state, and Katie backed me up on this, they asked us what resources we need. And we said, in no particular order, funding, manpower, and ability to testing capabilities, be it reagents, be it access to tests. We said what we need, and we were very forthright with them. And we also were very adamant about us needing to know definitively what our positive prevalence is through positive and negative tests, and not having to take a guess. We want to be able to tell Mayor Schul and Chair Jacobs exactly what our testing positivity rate is. So again, we continue to beat that drum. But as far as contact tracing right now, I think we're in good shape. But I'm going to never stop fighting to make sure that Durham is where they need to be. And I'm going to continue to take advantage of these resources that are being doled out by the state.
I just had 2 comments to add to that. Thank you so much. I think Rod is doing an excellent job, and so is the team. I just wanted to note that for CVS testing sites, children less than 18 cannot get tested at those sites, except if something has changed this week. So as we are broadening who we are testing, children still need a medical home of some sort to get access to testing. And then the other point that was raised that I think we should incorporate to any discussion about phase 3 would be the timing of phase 3. I appreciate, I think it was Nicole that brought up the point that the metrics are not necessarily a cause for alarm, but they are a cause for us to pause and reflect as to where we are headed. And the pattern over the last 2 weeks does not necessarily suggest that we are out of the woods. I think we're all aware of that. And so as we flesh out what phase 3 will look like, the most important point may be when to actually start walking towards reopening in a way that would remove some of the restrictions that are still keeping the rate down. Thank you to all the group. I'm sure this group is well aware of that, but I just wanted to make sure that's on the forefront of all of our discussions.
Thank you for that.
I have a just one question, and I want to appreciate Rod's fabulous report this morning, and just the can-do attitude that Rod always exhibits, and his department. It's just very confidence building, I think, for the rest of us to have him give us this great understanding and to talk about all the actions that they're taking. I just wanted to ask Pilar, and Rod probably has a good perspective on this as well. As we think about our Latinx community and the need for people who are culturally competent and truly bilingual, what would you say the resources that are there resources that we could bring to bear, whether provided by the state or locally, that would help us get people who can contact trace, members of the Latinx community here in our community, who can help with the contact tracing, who can, are there ways that we can recruit people, find them, bring them into the system, get the kind of training that Rod and his folks can provide? What would you say about that, Pilar?
Thank you for the question. Yeah, I think we can tap into health promoters that different organizations, like Duke or us at El Centro or UNC have for different programs. My question will be, what do they need to be trained? If they need specific, I know, HIPAA and all of that, but I think we could bring that resource. But so I don't know, that's what I was thinking and talking to Rod about how can we tap into this resource we have, because the health promoters are people from the community trying to help us in the work we do generally with the community. So I will be willing to talk about it and see how we can speed up this and help on that. But I'm not sure about the process and everything. And as I said before, we need to be, we need to have in mind the barriers and see how we can support them in those barriers. If some of them probably couldn't drive, they need to do it by phone. We need to give them probably, I don't know, a Google Voice or something, but I don't know if that's available, or so they don't have to use their own phone to make the phone call. So little details, but I think we can talk about it and make it available.
So Pilar, maybe we can add that to our agenda for our next vulnerable communities discussion on Tuesday.
Thank you, Kate.
Would that be helpful?
Yeah, definitely.
Okay.
All right, so thank you very much, Rod, for that great report, and I'm sure we'll continue to have dialogue on our metrics as well as contact tracing. Very informative, so I really appreciate it. And it sounds like you and Pilar will definitely connect just to brainstorm on how you can get some provider support. But as you think about as we go forward, if there's other help that you need from the task force, just let us know. All righty, I'm going to move us along on the agenda. So next up we have Lois, and she's going to give us an update on our community engagement strategy.
Good morning, everyone. Again, I want to add my thanks to all the great work that's being done. Everything we're doing is community engagement and community focused in some way, and we're doing some great work. Ed, Pilar, and I have been meeting weekly, and we greatly appreciate support from Amber and Sharon and Quelle and Brian and other staff and supporting us. We're really excited that Constance Stansel and Linwood Best of Neighborhood Improvement Services have generously signed on as key partners as we look to explore the best ways to engage and educate and inform the community at large. We want to hear community feedback at every level and to hear community concerns and needs. We're also coordinating with Susan and the communications folks who are on the task force. We want to make sure that any messaging or information we share is well aligned and consistent and accurate and as up to date as possible. We just heard from Pilar about some of the activities she's engaged with. So today we invited Linwood and Constance to join us to walk us through a very good draft of a strategy that they are suggesting that we might want to follow in order to be more thoughtful and intentional about engaging different segments of the community. So I don't want to take time now. I'd rather hear directly from Linwood to just walk us through it. I hope you had a chance to, we included the draft plan in the email last night, but Linwood will walk us through that. And introduce yourself first, Linwood, and take it away.
Thank you very much. I'm Linwood Best with the Durham Neighborhood Improvement Service. I'm the Community Engagement Manager, and it's my pleasure to be a part of this conversation this morning. Thank you so much for inviting us. I won't go through every detail of this report because I'm sure most of you have read it. But I want to get down to the meat of the report. Is really how we're going to engage our communities, how we're going to get them involved. And one thing we learned about community, they really want to be a part of the solution and have an understanding of what's going on. And we want to do that the best way we know how. Currently, we're going to emphasize or continue to expand working with the groups that we're already working with, our Partners Against Crime groups, and neighborhood council groups, and our commission groups, as well as other nonprofits and other groups. But we know that currently, because of the COVID-19 virus, that many groups aren't meeting face to face. A lot of them are actually now meeting online through Zoom and other programs, but there are some that still meet face to face. Actually, those meetings that we already attend, Partners Against Crime meeting and the council meetings, things like that. We can continue to do that and continue to spread the word and share the word with these groups to help get out to their members and memberships, so that they'll be aware and have an opportunity to have input into the recovery process from COVID-19. So our first group will be our partner groups, but also we're going to extend it to the groups that we not necessarily meet with them one-on-one, but we have an actual relationship with them. We got people that we talk to, that person-to-person communication, as well as we talk to their members, and we can actually email them and send flyers to them for them to send out to their community groups. And they'll be like our the People Alliance and the Racial Equity Task Force, Duke University, North Carolina Central Universities, the Community Health Coalition, and other groups that we are part of, that we can actually send this information out. We know their memberships, and we can actually share the information with them and have them be a part of that. Our timeline for this is actually starting June 10th through July 10th. And what we're saying is a month to actually be a big blast to actually get this information out to these groups, to have them to share it with their membership, and have them to provide us with some feedback, how they would like to participate through this. Also have them to say they have opportunity to, if they want to have a work group or roundtable or some of that nature, that we work with them to help organize and get that involved, so they have their feedback in this process. We work very, very closely with Durham Housing Authority. We are currently working with Maduga Terrace residents. We're working with Hoover Road residents, Oxford Common residents, Bluefield residents. And a lot, what we found out in doing that, when we got staff out in the community, virus is not necessarily something they truly believe exists. They have a problem with social discipline when they're all in the same household. And they have a lot of concerns that that they would like to bring to the table and like help and assistance in being addressed. There are things that they have a shortage of as far as products that they need from stores and things of that nature, transportation again there. They also talked about testing. On tests that were aware of, the one was on Guest Road. Well, how am I gonna get to Guest Road when I only can ride a bus to get there? And then I'm exposed the whole way there. I'm exposed all the way back. So there's a certain concern of those things that they want to bring to the table that they need help in addressing, and we're going to help get them to the table to do those things, and hopefully we can address them through this group. But we also have relationships with Henderson Tower and so forth. But also we work with barbershops. We actually work with Co-op Brothers and give information and flyers out to local barbershops, especially for men barbershops, that they'll be aware of the covering process. Because we found that many men were not wearing covers, and we want to find the information on how they can get them involved and show them the seriousness of it. It's not that they may catch the virus, they may catch the virus, but also they may take that virus back home to someone who's there, elderly parent, a child, something, then you know the importance of wearing a cover or a mask. So we're reaching out with that. And we also are working with neighborhood association. We have access to neighborhood association listserv where we can actually send information out to those listservs to get them involved, let them know what's going on. And so we're really excited about doing that as well. And so once we have the flyer and hopefully have a supporting letter from the mayor and the county commissioner, Jacobs, we would like to send that flyer out with that letter saying, hey, we really want you to be a part of these roundtables. We really want to get your feedback. We really want to know what you're thinking and how we can help and how you would like to help us to address this issue. Through the month of June, also through the month, we work with community rooted partners. I don't know how many of you are familiar with our community rooted partners. They are on the ground groups that are actually working in the communities. And these are people who know their neighbors. They call their neighbors, they talk to their neighbors, and they really know the language of the community which they are in. And they are in the community to help us get the message out. And we have several of those, and one of them is Community and Partnership, and you may know Cameron Smith and that group over in Northeastern Durham. It's over in Northeastern Durham as well. That's Adele Otis. I can't remember her last name, but Ideal. And you know that she works also in McDougal Terrace. And they are really, really working to get people involved and get that information out there as soon as possible. Actually, on June 20th, they're gonna have a parade. It's gonna be tied with the Simpsons Parade, where they're gonna go out through those communities and they're gonna inform people about the census and what's going on. We're hoping to have City Hall and go in that event, we will. And we hopefully have some face coverings that we'll be able to share with the community, as well as this information about the COVID-19, as well as information about the census checks and other, and most important, census, to fill out the census. We're also working with the community group. They actually have supposed to have a outreach today at Chicken Hut and at New Vision Africa to talk about the census. We're going to provide them with iPads to take out into the community to help people to complete the census form as well. So we are doing outreach, and we are having outreach, and we want to continue to have that outreach within the city of Durham. Our next area that we want to talk about is social media. We actually have a Spanish Facebook that we would like to continue to share with the community with the information in Spanish to make sure we reach out to our Latino population. We have over 500 people so far who say they like our articles and are followers of our Facebook account in Spanish. We also provide a NIS newsletter, community newsletter, and we also are working on putting another Facebook together particularly for community engagement and neighborhood improvement service, so we can actually have another means of getting this information out besides the actual city Facebook site. So about that, but we're also still in partnership and want to continue our partnership with the Public Affairs Office, because we want to actually use them to help us get the information and data out for on the Durham Network TV, press release, and so forth. So we'll be using those methods to do that. But as I mentioned before, we have City Hall on the Go, which goes out into the community to provide services. One of our employees said that when you see City Hall on the Go, you know help is on its way. And we want to make sure that we let people know that help is here and that we can help provide them and inform them and give them the help that they need to help make their lives better. We also have a Nation Builder process, which we plan on using as well. And Nation Builder is an opportunity for us. It's a software product that we use to help keep in contact with people.
Mr. Best, I think we're having a little trouble hearing you there.
And what the Nation Builder is about is that we have a lot of one-on-one conversation with people, and they're very interested and want to be very well informed. And what happened? Nation, can you hear me? I don't know what happened. Better?
That's better. Yeah.
Yeah,
Yep.
and if you slow down just a tiny bit, I think some of it also on my end, it's a little bit of echo and a delay.
Okay, I'm sorry. Excuse me.
No, that's okay.
That's all right.
Technology.
We're all learning this technology together.
Linwood, this is Steve. Linwood, I have one other suggestion, which might be if you turn off your camera, you've got limited bandwidth. It might help your voice come through a little clearer.
Okay.
Try that and see if that helps at all.
How's this? Is that better?
Yeah.
That is better.
Okay. All right. Okay.
I just learned something new too. I didn't know.
Thank you. I really appreciate that. Thank you for letting me know.
No.
And if I'm talking too fast, please slow me down. I have a tendency to begin at one time and try to other. And Nation Building is actually out to get in touch with it through our community engagement site on neighborhood improvement services. And what we use that for is people actually have opportunity to sign up and request material they want. Say if I'm interested in housing or transportation, and I only want those things from the city. Well, I sign up the Nation Builder. When something come up about housing, we'll send you an email through Nation Builder. If something come up about transportation, we'll send you an email about transportation. So Nation Builder is an opportunity for people to actually be a part of the government and not be overthrown with everything the government is doing if they're not interested in it. You have an opportunity to select what you'd like to be involved with. And we like to use Nation Builders to help people to understand. So that will be one of the tools we will continue to use in this outreach process as well. We have City Hall on the Go, as I mentioned before. And some of the dates that we have for City Hall on the Go is June 17th, which will be at Hoover Road, Liberty Street. We're going to be on June 20th, of course, I mentioned the parade that we'll be taking a part of. And on the 24th, we'll be at Club Boulevard. City Hall also be working with El Centro during the months of August and September and October, and Compare Foods. We'll be out in those areas as well. And that's listed in the report that I submitted. How we would like to address avenues addressing those concerns is that we would like to have small neighborhood roundtables that can be in person or that can be by Zoom. I have a community group that met on Monday at Junction Road and Ross Road, and I asked them, would you rather have it in person or would you like to have a Zoom? They said, well, based on our community, we would like to have it in person. So we went out, we got in front of someone's front yard, set chairs all the way out, spaced them out, and we had masks on, and we didn't touch, but we had a conversation. We had to put our masks down a little bit to have the conversation. But have a conversation. We'd like to continue to do those type meetings in the future. That can be in person, and they don't have the capability of meeting online to have those face-to-face conversation. We realize that both work. You can have the Zoom conversation or the face-to-face. Either way will work. We like to have small community conversations with those. We like to work with our youth group, continue to work with youth groups, continue to do our Zoom community town meetings, outdoor meetings, and if people have concerns, we encourage them to send their feedback concern to the RRTF at durhamnc.gov to provide us with feedback. And from that feedback that they provide, then we'll be able to continue to address their needs and concerns. That's basically my report. I'm sorry if I seem like I rattled through it, but if you'd like for me to repeat anything, say anything over again, I'll be glad to do it. Thank you very much.
Thank you very much, Linwood. I think the main takeaways today that we wanted you all to have a chance to see the draft report, to know that we're working with an agency that already has boots on the ground. And in fact, Linwood, if you would just describe for those who are not familiar with neighborhood improvement services, your staffing. You did mention, for example, some of the campaigns and work you're already doing in neighborhoods. For example, you mentioned you're working on with community members around the stimulus checks, understanding how to access that and census work. But if you would just briefly describe the staffing and the group and just as context here.
Okay, so Neighborhood Improvement Services is a group as part of the city government we actually provide community. One of the things that we provide is community engagement. That's the department that I'm a division that I work with. Currently, I'm excited to have a new staff person that replacing one of my current staff person, and she is language, and that she will be starting July the 6th. And she be primarily working in District 1, which is Northeast Central Durham population out towards, especially Hallway Street all the way out. The other person I have working with us is Alexis John, who's fairly new, really energetic young lady who actually comes to us to help us. She's the one that actually is driving our City Hall and Go vehicle now, and very engaged in the community and working with Oxford Manor and other areas. We also have Pam Pagan, who actually works in District 4, who is working with those areas with Mr. Chestnut in that PAC area. And then we have our equitable community engagement coordinator, Laura Builder. And that's about our blueprint. I don't know how many of you are familiar with the city's blueprint, community engagement, equitable engagement blueprint. That is about bringing everybody to the table, making sure that everybody's opinion is valuable, making sure those areas that are highly impacted are at the table and represented when things are occurring, so they have input in the beginning of the process instead of seeing the results at the end of the process. So we were working with groups of that nature. And that's how our community really organization started, from that group, where we actually needed to know first how the community felt about things, how to get into these communities that we hadn't been getting into because people had lack of trust for government and outside entities. So we work with that. We're working with that, and also have a building equity group that we're actually working with to help build equity in our communities by working with neighborhood groups to do that. So that's just a short thing of some of the things that we're doing in our division, and we have supported all other organizations, neighborhood and other programs that are going out into neighborhoods to try to keep people informed of what's going on within the city of Durham, what's going on in the neighborhoods, how to build their neighborhoods, build capacity in neighborhoods, and things of that nature.
Thank you.
All righty, so thank you so much. Lois, I didn't know if you had anything else.
No, the request would be to take for members of the task force and the community to take a look at the draft plan, to please provide any feedback. I think we're working, as I said, in alignment with the community, with Susan and communications. For example, when Linwood mentioned the flyer that we are developing, it primarily is to collect information. You know, do you have what you need to protect yourself? Are you aware? Or do you have concerns? And it would be in print, but also electronically. We're hoping, as Linwood said, to push things out via social media, and anything we're developing, any member of this task force or any member of the community can then share it with their networks. I think that's really the approach we're trying to take. We're hoping to work with neighborhood services, improvement services that already has existing networks, campaigns that they're working on. We want to tap into that to create materials and create processes that we can then just expand, you know, that anyone can use and access.
All right, great. Thank you. Thank you to you, Lois, and Linwood as well, for all the great work. Great report that you provided. And as Lois asked, if the task force would please take a look at that report and provide some feedback. And it's great to see that we are leveraging an existing agency so that we're not starting from scratch trying to move this engagement work forward. So thanks so much for that update. I'm going to turn it over to Katie for a discussion on vulnerable populations.
Great, thank you. Great dialogue this morning. I really appreciate all of the energy and the passion for the work that we're doing. It's exciting to see and very encouraging. So the Vulnerable Communities Action Team met earlier this week. We've talked some about this. I'll ask Phil to join me in adding in, and any others who were, Pilar was certainly there, Rod was there. We've talked, we're really focused right now on the testing strategies and again, trying to expand and have testing available in East Durham, through El Centro and expanding testing capacity at Lincoln. So that's really the focus, and a lot of work going on to make that happen. We have a meeting again on Tuesday afternoon, and we'll have updates after that. I don't know, I know we've talked some about this already, but Pilar, Phil, Rod, anything else that you want to add on this?
Just to confirm what you said, that at Lincoln, we're doing our best to ramp up our testing capabilities. We're having some success. The challenges are around workforce issues, as we raised in our meeting. And we've been able to come to an agreement with Duke. I believe that's community and family medicine, and they're going to help us with some of our testing. We have another opportunity through the North Carolina Community Health Center Association, who has who's had conversations with Old North State to see if they can help out with workforce issues in some communities. So we're in the process of talking to them, and if things work out, we'd be able to add another testing site in this community. We, of course, once Houghton reopens, then we'll have conversations with Michelle Lynn and Fred around the possibility, because that's the one site that we have that's located in East Durham, Northeast Central Durham. So that's a possibility. Just want to add that, I'm really impressed with the efforts, especially to distribute the masks around the city. And I think adding Linwood's group is going to be tremendous in terms of making that a success, because we know the things that work to slow the spread, and wearing face coverings is one of the most important things that we can do. So appreciate the fact, Katie, that you've been so cooperative in terms of helping us with face masks and other PPE from the beginning, and now the fact that you're helping us to get some additional testing capabilities. It's much appreciated. Just want to make a related point. I was looking over the 2019 State of the County Health Report that's put out by the Health Department. It's a very impressive document. It takes the community needs assessment and it updates it every year. And it's called the State of the County Health Report. If you have the opportunity to look through that report, it reminds us that the 5 priorities for the county are affordable housing, access to health care and health insurance, poverty, mental health, obesity, diabetes, and food access. So as we try to meet the challenges of the pandemic, the county and here at Lincoln, we still have to take care of those priorities that we know are areas where there's still opportunity for improvement. But I also want to give the county kudos for an excellent report. And of course, the effort was part of a collaboration, as we always do in Durham, with the Duke University Health System and a myriad of smaller nonprofits who are involved in this process year by year to put together the needs assessment and this annual update. Thank you.
Thank you so much. Any additions to that? Anything else? Anyone wants?
I just want to say we've talked about our health department, and Lincoln is another group that's on the front line, not just public health. Lincoln is really on the front line. And as Phil knows, my next door neighbor has been a doctor at Lincoln for 30 or 40 years. I hear every day of all the incredible challenges you all have faced during this period. I just want to express my gratitude again, Phil. You all have been amazing. So thank you.
Thank you, Mr. Mayor.
I will echo that. Absolutely.
Thank you.
Tremendous. All right. let's move on then to the update on our partnership, the pro bono partnership that we've had with McKinney, which I think is really exciting. McKinney joined us with Center for Advanced Hindsight a couple of weeks ago and put a full team on this. You know, we're fortunate. McKinney is actually a national advertising agency, communications agency, but based here in Durham. And so they put a full team on this work to really help us on the messaging and tools for messaging as we're working through reopening. And Ryan, do we have that? Do you want me to share my screen? Do you have it to share? How are we?
Sure, I can share it right now if that would help.
Either way, if you want to, or I don't know if I have. Oh, you've got it.
Can you see that?
There we go. All right. So McKinney has been working on this, as I said, and they did some initial testing on it and have, I think, a really neat Durham retro feel to this. And the theme is, let's get back on the bull. The road to victory is 6 feet apart. And it really is a whole combination of communication and messaging tools that will be able to be used throughout Durham as we move forward, not just over the next 75 days, but really over the next probably several months. So let's get back on the bull. There's a whole website that goes with this, with rotating images on that website. Lots of information for our community members, for businesses, for organizations, information on how to stay safe, information on how to support local businesses. All of that will be on this website. Participating businesses, those that are participating in this self-certification and voluntarily saying, you know what, we're going to follow best practices here. There are additional resources that will be available. There is the survey tool that I think Marielle went through last week with us. That will all be embedded in the website. There are signs that businesses can put up in their places of business that talk about the importance of social distancing, hand washing, etc., and their commitment to that. Information for staff and for management. So a lot of tremendous information in the website. And then there's also social media. So there's the idea of all the marquees in Durham taking over and having this let's get back on the bull, social media postings, stickers that we can put on our own social media posts. So they've had a lot of fun with that. So this is the concept and what we're moving forward with. I think it's really exciting. Would love to have any general feedback that folks have, but we're excited about it and very, very appreciative of McKinney and Center for Advanced Hindsight for all of the work that they have done, again, pro bono.
Katie, I just want to add one thing that Tilde is working on translating everything, and we will be rolling it out English and Spanish at the same time, and we hope that we're about a week away. So just wanted to add that.
Thanks for that important reminder, and thanks to Tilde as well.
And this is Marielle, just to also note that one thing that we are sort of emphasizing throughout with this is that it really is about getting back on the bull in a way that is stronger and better than before, not just sort of a returning to the way things were, but really about making sure that we're getting back on the bull, but in a way that's going to be better than before. So just kind of wanted to emphasize that as well.
Great, thank you for emphasizing that. Yep, important point. Thoughts?
I want to go ahead. I'm sorry.
No, go ahead, Mayor Schewel.
I just wanted to say I think it's such a great slogan and campaign, and really want to thank McKinney. They busted it for a couple of weeks now. They put a full team on it. They worked very closely with the Center for Advanced Hindsight to include the behavioral economics kinds of aspects of this. And I think one thing that Ryan has done a great job putting all the players together. And Ron, I think it would be good if you would talk a little bit about your conversations with American Tobacco and American Underground, who've already decided to, who've jumped on this early. So could you talk a little bit about that?
I'll just say at a very high level, I've had conversations with Adam Klein at American Tobacco. He's with Capital Broadcasting, and he has reviewed this with his team and said that they are excited to get behind and support this. And we'll be talking more with them about what that looks like and be working with other businesses so that when we launch this, we have businesses that are already behind it, who are ready to participate and help raise the visibility of this. So I think that's really all there is to share now, but we'll be working closely with them and then working with our roundtables and others to build support so that when we roll it out, we already have a number of businesses in our community getting behind it.
And Ryan, what is the timeline for us for rolling this out other than yesterday?
Yes, well, I mean, one, I just want to thank, we have, of course, not only do we have a volunteer team doing this, but we have volunteers who are putting in hundreds of hours. So I hope, and I'll say this, and then Marielle, who can step in and fact check me. I think we're a week to 10 days away. So right now, a web developer is building it all out, again, all for free. Marielle and her team are finalizing the survey. They've already gotten initial rounds of input from Dr. Akinboyo and from Public Health, and there'll be another round of that. They're meeting with roundtables next week to get additional feedback on the what's referred to as the kind of survey or business checklist tool. The goal is that will be rolled out in English and Spanish with multiple industries that have a kind of checklist component on it, and that we are busting it a week to 10 days away. Meryl, you want to fact check or correct any of that?
Nope, that's the timeline we're driving towards.
And I just want to jump in here to first of all thank you, Ryan, for leading this effort, and also to really recognize McKinney and Center for Advanced Hindsight, for you, Marielle. Again, this is an incredible resource that we can bring to support the businesses in our community. I mean, to have a world-class advertising company provide all of this work to us for the community for free, and also a world-class institution at Duke like the Center for Advanced Hindsight, again bringing the expertise, the talent, the creativity, again a gift to our community, to our business community. And I'm just really excited about the theme, getting back on the bowl, and that this will be something that is just high quality, first class, and that will be accessible to anybody in our community who wants to participate can be a part of this for free. And so I'm just really grateful to, again, McKinney, Center of Advanced Hindsight, Brian, Marielle, everybody who has really gotten us to this point. I think everyone's going to be really excited about this, and it will be another way for all of us to get back on the bowl together.
Thank you. Any other comments or feedback on this?
I just want to thank everybody in the task force for having the consideration of language justice, because I really see it all over for the roundtables and the communication. So thank you.
Thank you, Pilar. Okay, I will turn things over to Maticia for our last 9 minutes.
So with 9 minutes left, I just really want to open it up to roundtable for the task force. And just, are there any topics that anyone on the call would like for us to cover during the next, I would say, 5 minutes, 5 to 6 minutes? Is there any precedent topics? Well, that means we've had a really good meeting. If Ryan.
Can I ask a question if no one else? So one of the things I heard on one of our restaurant roundtables that I wanted to ask for advice on is, many of our restaurants are working closely with DDI and others on thinking about how to expand outdoor dining. one of the questions I heard voiced was, how long should restaurants be thinking about outdoor dining? Because it will be some investment for them to prepare for that. I know that there was, is outdoor dining something that we will likely want restaurants to be thinking about and practicing for, an extended period of time, more than 3 months, longer? I just heard that question, and there were many other questions I lifted up, but I think for planning purposes, it's a practical question for them. And I'd love to hear from either our public health experts or Dr. Akinboyo. Just if you have any thoughts on that, or if not, we could follow up afterwards, but wanted to lift that question up.
So I would say realistically, it's hard to give a defined timeline. And the expectation is that we will be dealing with mitigating COVID-19 for a good amount of time, and at the very least for the rest of the year. And what that might mean is we just have to adjust our expectations for going out to eat. So if it's not COVID-19, it could be the next infection. So whatever accommodations we're making should be somewhat semi-permanent to allow some flexibility as we go into the fall and winter months.
It also may be helpful for restaurants to understand, if there is support from the county and the city for this to allow it to be more permanent, even after we get past this immediate crisis. I would think that might be attractive to some of the restaurants. I don't know, I'll look to Nicole and Susan maybe for more on that, or Geoff, but certainly if they're going to be making the investment, but I think that many residents would probably like to have more outdoor dining options. But the restaurants are probably not wanting to make that kind of investment if it's going to be shut down and they won't have that opportunity after we get through this. So is that fair, Ryan, in terms of what the questions were, or am I misreading that?
No, I think that's part of the questions, and just that there might be some cost if they want to make it a pleasant experience for outdoor diners. But if one of the things that one of the restaurants voiced is there'd be some cost in that, and it may not be worth it if it's a very short-term thing, especially as some of it is hinging on some changes in local ordinances. And again, Nicole can correct me in what I'm misstating here, but this has been a helpful conversation. I appreciate it.
My question would be interested in knowing how long. We've been working with the city on trying to finalize the ordinance that should go before City Council, we hope in the very near future. And looking at some ways to address the challenge of the alcohol, providing the alcohol within these seating areas. The state's not, I won't say they're not cooperating, but it would be helpful if we could go ahead and get an ABC bill passed that would make that kind of rolled out at the same time, but we're not waiting for that anymore. But certainly there are some restaurants that would like for this to take hold and be available even after COVID. That's a conversation right now. We're just trying to help the restaurants get back open to as close to full capacity as possible. But that question has come up. Should they make that investment? What does that investment look like? How nice do they go? And I will throw out there that there is some conversation as well about, is there any kind of assistance? This is not something that they were really thinking about doing it, but because of COVID, they must consider it. So is there any assistance from the city, the county, to help with purchasing of equipment, chairs, tables, the barriers, tents, if they have an area that is not shaded by trees, because that's just not something, they certainly don't have any extra money now, and not something that they were anticipating having to purchase and moving forward. So that question is being discussed quite heavily.
I was just going to ask really quickly about data and information around consumer confidence. I forgot where I was reading, maybe it was the Times or one of those, around even if, do you plan to go back inside a restaurant, in the next 60 days or 90 days or 120 days. So in addition to whether it's mandated or not, what data and information are businesses using to determine what consumers may expect or want?
Lois, can you guys hear me?
Yes.
Can you all hear me? No.
But you went on mute. We could hear you, but you went to mute.
All right, I'm back now. Sorry about that. Fun times today with internet access. Anyway, I would like to mention to the group, specifically in response to Lois, is part of sort of this economic recovery committee, both Ed, Anthony, Nicole, Susan, myself, Pilar, had a chance to convene this week. And that was certainly one of the things we talked about. We're looking forward to continuing our conversations, but Lois, to your point, looking at consumer confidence, consumer behavior, that was one of many different metrics we're looking at and anxious to kind of explore a little bit more. We're looking forward to the great work that you guys have been doing with the Back on the Bull campaign and kind of integrating that into a broader recovery strategy. We're not really prepared to report out too much, but I'd certainly love to turn it over to anybody else on that committee if they have something.
I think the first meeting we had was a good meeting. We had a long list of things that would be great to cover, but I don't know that any of us have the ability to take on that list of 100 plus of we should do this and what about this and let's look at that. But as all first meetings go, you throw everything out there and it's you're very excited. So it was a good conversation where we all shared our thoughts about what the recovery might look like, with none of us knowing what the recovery will look like because none of us knowing what's going to happen, tomorrow, much less three months from now. But I think we got a good start under Geoff's leadership, but really good input, and hopefully we'll be able to report something that a little more concrete once we've met a couple more times and can really kind of narrow on the things that we will focus on immediately.
All right, very good. Well, we're right at 10 o'clock. So
I have one quick question. I'm sorry.
Yes.
Rod, is your key metrics report a public document that can be shared?
Absolutely.
Okay, thanks.
Awesome. So we're right at 10 o'clock. Again, many thanks to all of you for your engagement this morning, for your continued work. I captured 3 items coming out of today's meeting that I just want to highlight. And Katie, if I missed anything, please let me know. But based on our conversation today, Rod and Pilar are going to connect just to have some conversations around contact tracing and how do we address some of the issues that we're having with the Latinx community. We're also asking the task force to review the engagement plan that was shared and provide any feedback to Lois on that plan. And also your homework assignment to think about what could possibly come out of phase 3. Think about it from the Durham perspective, and what are your concerns that you may have as we think about moving things forward. So just want to have a robust conversation in our next meeting on that. Is there anything that I missed, Katie or Ryan?
No, I think that's a good summary.
All right, very good.
Can I just raise one thing? Sorry to be that person that keeps doing this. The information that was sent out with the agenda was great. The briefing material was wonderful. I couldn't look at it last night. And I hate to ask, I hate to be that person because I know all of us are doing a lot. So Ryan, I really hate to do this, but if there's a way to get it a little earlier, but I'm trying desperately now to stop if I can and focus on personal time, as I'm sure all of us who are doing things running around. If there's any way, if not, then I will carve out the time. And again, I really hate doing it and I thought long and hard, but if there's a way we could get that information a little earlier, because there was a lot of stuff and I was looking through it as we were going through the meeting.
Yeah, I appreciate that. Let me say that what I'll start doing is a new practice and response. That is, if you are okay with things being added to that, we're meeting every week. We have meetings Wednesdays and Thursdays. We have staff working long hours trying to pull things together, but I think we could have a working document. I could send out an agenda, even a working agenda that might change over the week, but also working briefing materials that we're continuing to add to. That way, you all can begin reviewing materials as they're ready, knowing that there might still be some things that we add the night before just because of the nature of the work. But I could definitely commit to doing that and getting out even Tuesday, like with initial briefings and initial agenda. Does that sound like a good?
That'd be great. That'd be much, I'd be okay reading 1 or 2 documents as opposed to 15 Saturday, Thursday night at 8.
I know, I apologize. We're working hard.
No
to get
problem.
there, but
No problem.
Thank you.
But I really appreciate it. It was great information. It was just a lot.
Yep. No, I appreciate you bringing that up. I had the same thought last night. So you are definitely not alone in that. So thank you. We can work on that.
And as I said at the top of this call, we welcome any and all feedback. So thank you for that, Nicole. I appreciate you sharing that, and we'll work really hard to see what we can do to address it. So again, many thanks to all of you for your continued support of this task force. I appreciate your active engagement, all of your hard work, and I hope all of you have a great weekend. Thanks so much for all that you continue to do.
Thank you.
Thanks, everyone.
Thank you.